Well, after treatment, there are sort of two stages following treatment. One is, of course, after a surgery. And then if somebody's going to get radiation and chemotherapy, what happens after that particular treatment. I think that the key with any brain tumor diagnosis, in terms of what a person can expect, is that they're going to have regular MRI scans. The frequency of those MRI scans varies depending on the diagnosis. If it's something that has a little more propensity or frequency in terms of changing or growing, those MRI scans are going to be closer together, maybe even 2 months apart. If the problem is a slower course, a more benign type problem, the scans may be every 3 or 4 months, then stretched out to every 6 months, and even a once-a-year scan. But one thing that people can count on is that once they have that diagnosis, whether they have surgery or not, they're going to get regular MRI scans, because that's our best way to monitor what's happening with the tumor. Following surgery itself, people obviously have their stitches or their staples removed. If it's a problem that requires additional treatment, they would be sent to see the oncologist or the radiation doctor. Usually people are back to work around a month. It does vary a little bit depending on the job that the person does. Usually by 2 or 3 weeks, people are feeling pretty much back to normal in terms of their energy states. A lot of that depends, of course, on where the tumor is located and how the tumor might be affecting different parts of their brain. So there's a lot of variability in that particular issue. The normal stay in the hospital is around 3 days, plus or minus a day, depending again on location, diagnosis, and some other factors. But the goal is to get people through the process quickly, get them back to their normal living environment, and get them back to their normal level of function as quickly as possible.